Force field analysis. The force field analysis provides insight to forces that are either detrimental to or aid in the success of a desired outcome. During the plan phase of the PDSA cycle, members from the healthcare organization, which may include the IT department, education department, and managers, will create a force field analysis to determine restraining forces for implementing the new workflow. For this plan, there are three main driving forces. The first and most important being that patients will not experience adverse medication events related to IV incompatibilities. With the BCMA system having required fields for other infusing fluids for all IV medication administrations, this will prevent nurses from administering incompatible IV medications and/or fluids. The second driving force is that nurses will have peace of mind knowing that they have better resources available to them so that they do not carry out a medication error due to unknown incompatibilities. Through the BCMA prompting them to input other infusing solutions, this allows the nurse the ability to physically look at what's infusing while in the room and does not require them to memorize compatibility charts before entering the room, and prevents them from having to leave the room to return to the med room to look at a compatibility chart if they forget while they're pulling their medications. The BCMA will also have a link for an electronic version of the compatibility chart available on the Electronic Medication Administration Record, EMAR, so that nurses can check compatibility from their computers while they have their EMAR open and are able to view medications side by side with the compatibility chart. This allows them to pull any and all necessary supplies in the event that they need to start a new IV access site, get different IV tubing, and more. Lastly, the third driving force applies to new nurses. New nurses are more likely to forget to check compatibility charts before leaving med rooms, have a harder time remembering multiple tasks for different patients, and struggle with juggling the heavy workflow in addition to not being able to recognize an incompatibility reaction or have the ability to intervene quickly enough before a patient experiences harm. This leaves them especially prone to errors with IV incompatibilities. The new functionality of the BCMA will prevent these errors from happening by stopping the nurse if they are about to administer incompatible medications or fluids. With every new workflow, there are driving forces as well as restraining forces. The top restraining forces for this plan include time constraints, pushback from nurses, and cost increases. Implementing this new workflow would add additional steps to the medication administration process for nurses who are already overwhelmed and juggling several things at one time. This will inevitably lead to pushback. Additionally, the process of creating the new functionality, training educators and IT staff so that they will be able to educate nurses, and putting the new workflow into practice will all take time and money. Managers and hospital administrators may be hesitant to pay for the new functionality and training, as well as set aside the time needed to carry this plan out. The time needed to carry this plan out and create the proposed plan would take approximately 3 to 6 months, with the possibility of taking longer depending on needed adjustments, pushback, and more. Through utilization of the force field analysis during the plan phase, this allows the necessary parties to strategize ways to combat these restraining forces before they arise in order to aid in a smooth transition.